from the station that's on your side. This is Channel 7 News Daybreak.
6:23 is the time. February, of course, is Heart Month. We've been talking about all month long. But if you're trying to lose weight to help your heart, you might want to listen up, because maybe not your weight, but your waist might actually be more important than your weight for multiple heart attack risk. Joining us this morning to explain, Baptist Health cardiologist Dr. Scott Davis. Tell me more about waist size and why that might be more of a factor.
So several years ago, back around 2014, in this segment, we talked about the association between waist circumference and the risk for heart attack. And that was borne out in some primary prevention studies that were done. And now fast forward 5-6 years later, we're finding that it holds true for folks that have had previous heart disease. And so the connection here is that waist circumference, belly fat, is an independent predictor of a future event, either a future heart attack or a future stroke for folks that have already had documented heart disease. And it's independent of being on the right medicines.
Okay.
Right? So oftentimes after people, have had a stent or have had bypass surgery, they think, well, I'm on an aspirin and I'm taking my cholesterol medicine, I've got my blood pressure under control. But if we're not attentive to the waist circumference, that can put you at an increased risk for having a future event.
Okay.
The issue is why, and the speculation, because we've not done that part of the research, is it's presumed that then more visceral fat is stored in the belly, right, versus subcutaneous fat, just the surface fat. The visceral fat may have more of the LDL, the bad cholesterol component there, and so it's important for folks to pay attention to this and realize, look, I need to do all the right things as far as taking my medicines and doing all the preventive maintenance, right?
Yeah.
But we also want to continue, like we've always said, continue to emphasize the exercise piece and the diet piece to really reduce that belly fat part. The other little pearl, we tell people this all the time, is that you can't spot reduce, right? So it's like, well, I need to get rid of the belt size.
Go down a few notches, right?
Yeah, right. Yeah. And so I need to do more sit-ups, right? And so, it'll tone up your abs, but it doesn't result in spot weight loss.
Okay, it really comes down to what you put in your body.
Absolutely, and getting off the couch.
And yes, of course. Now, what about men and women? How does it impact
this seems to have a more linear impact to men.
Okay.
And men tend to have that more visceral fat stored here than women do. But
beer belly.
But it still can impact women as well. Okay. So, like we've said, heart disease does not discriminate. Yeah. And so women are at just as much of a risk for having an event.
Right? Yeah.
Absolutely.
Yeah, for women.
Compared to diseases 2 through 5 combined.
Wow.
So we really want to heighten the awareness for women as well throughout, all of our education and awareness. But this did impact men a little bit more. So the future studies that will come out is, okay, what is the underlying cause of this? Is it in fact the LDL piece that may be stored in that part of the body fat?
All right, Dr. Davis, thank you as always for coming in and explaining that. Here is the number for Baptist Health, and the information on the top left will indicate the website, baptist-health.com. For more resources, just go to their website and you'll find anything you need there to get you healthy, happy, and on your way.